Welcome to Community Health Briefs, where AI hosts share short, clear stories about research shaping healthier futures. Each episode highlights new work from members of the College for Community Health at Montclair State University, showing how ideas connect to the social and structural forces behind health. In short, this is research you can trust, explained by AI in minutes.
Today, we're looking into something really critical in U.S. healthcare maternal health. Specifically, why outcomes can be so different for different people.
Exactly. We know birthing people of color often face higher risks, and sadly, many report bias or just not being heard in typical hospital settings.
But there is another option, right? These freestanding birth centers. They seem like a great solution, offering more supportive care.
They absolutely are. And we're digging into research today from Dr. Becky Ofrain. She's an assistant professor of public health at Montclair State University.
Right.
And her work really focuses on these systemic drivers of health disparities, things that make it harder for some people to get good reproductive health care.
And birth centers fit into this because they're seen as this high-value, midwifery-led alternative.
Yes, high value is the key phrase. The evidence is there. They have really positive outcomes, lower preterm birth rates, fewer C-sections, especially for low-risk pregnancies, and they often do it more cost-effectively, too.
So, better care, better experience, potentially lower costs. It seems like a win-win. Which brings us to the main question, I guess.
Right. The mission here is to figure out if these centers are so good, particularly for populations facing the biggest barriers, why aren't they more common? Why is access still such a struggle?
Especially in places like New Jersey, which this study focused on.
Exactly. So Dr. Ofrain's team asked, what are the systemic barriers keeping birth centers from being, properly integrated into the main health system?
And how did they figure this out?
They did qualitative research. Basically, they talked to people, lots of interviews with professionals from all sides, birth center folks, hospital administrators, policymakers, people from state departments, insurance companies.
Got it. So talking to everyone involved to see where the roadblocks are, what did they find? What are these big barriers?
Okay, the first one, and honestly, it sounds like the base, was just a fundamental lack of understanding. Systemic ignorance, really.
Ignorance about what birth centers even do.
Pretty much. Across the board, hospital clinicians, state regulators, sometimes even the public, there's this misunderstanding about what midwifery care involves, how safe it is, how it integrates with hospital care when needed.
Wow. And that misunderstanding has real consequences, right? Like creating friction.
Massive friction, especially around patient transfers. Sometimes a person needs to transfer from a birth center to a hospital during labor. That should be a smooth process.
But it's not.
Often, no. The study highlighted the stigma. Hospital staff sometimes complain about receiving, and this is a quote, train wrecks from birth centers.
Train wrecks.
Yeah.
That's incredibly dismissive. Especially if the overall data shows better outcomes at the birth centers, it sounds less like ignorance and maybe more like, I don't know, turf protection?
It certainly has that feel, and that attitude directly leads into the second barrier. Poor workforce and care network integration. Those relationships are just broken.
Because if hospitals view birth centers negatively,
then they're less willing to build good partnerships, right? Transfers should be seen as the system working well, getting the person the right level of care when needed. It requires collaboration, trained teams, respect, but that stigma gets in the way.
Okay, so we have misunderstanding and bad relationships. What else?
Barrier 3, the administrative side. Specifically, licensure and dealing with Medicaid. It was described as, a nightmare.
Oh, so?
Disorganized processes, state departments asking for the same information over and over, losing paperwork, high staff turnover in those departments, meaning birth centers constantly had to, quote, start over again from square one, explaining everything to new people.
Oh my gosh. So you're trying to provide essential care, but you're bogged down in this endless, inefficient bureaucracy just to get licensed or get paid by Medicaid.
Exactly. Think about the delays that causes for families who rely on Medicaid. It directly impacts access.
Which connects to the social determinants of health, I imagine.
Yeah.
And that brings us to the fourth barrier.
Yes, barrier 4. Geography and transportation. There are rules like birth centers needing to be within about a 20-minute drive of a partner hospital.
Okay, that sounds reasonable for safety, but
it creates what the researchers called birth center deserts. Huge areas with no centers. Think about cities like Trenton, which has really high rates of Black and Hispanic infant mortality, limited access there.
right. because maybe the hospitals nearby aren't willing to partner, or there isn't a suitable location, or setting one up is too hard with the bureaucracy we just talked about.
All of the above. And while some people might be able to drive, say, an hour and a half to get to the birth center they want, that's just not realistic for lower-income families. Limited car access, public transport issues, it's a major equity problem.
And the few centers that do exist are often providing really vital, culturally specific care, aren't they? Serving particular communities.
Absolutely. The study mentions centers specifically serving Black or Orthodox Jewish communities in New Jersey. They fill a critical gap.
So putting it all together, misunderstanding, bad relationships, bureaucratic nightmares, and geography. What can actually be done? It sounds like we need education. Badly.
Definitely. Educating hospital administrators and clinicians is key. Maybe implementing models like smooth transitions, which trains providers on how transfers should work, reducing blame.
And fixing the state processes seems crucial too.
Without a doubt. Streamlining that Medicaid and licensure process is essential.
So the big takeaway here isn't about the quality of care at birth centers, is it?
Not at all. The main insight is that these centers are proven to improve outcomes and experiences. The barriers aren't clinical, they're systemic. They're buried in misunderstanding, red tape, and infrastructure gaps.
Thanks for listening to Community Health Briefs. This podcast was created with the help of AI, verified by the paper's author, and does not necessarily reflect the views of the College for Community Health or Montclair State University. Thanks again for listening, and stay tuned for our next episode. Make sure to subscribe and check us out at www.montclair.edu/CCHL to learn more about us and the amazing work we're doing for community health.